Hello and welcome for today's talk. Last week we talked about the breast, self-examination of the breast. We were dealing then with breast cancer. Today I would like us to talk to another very important part of a woman's health, and that is cervical cancer. One of the basic things is checkup. Annual checkup generally using pap smears. Want to demystify what pap smear is and look at how it is actually done and the importance of the same and some aspects of cervical cancer. This is Dr. Orora Maranga, consultant gynecologist and cancer specialist from Janice Hospital in Nairobi. We're going to start off with a demonstration. Today we're going to show you how it is actually done, and I'm here to show you all that. And it's here we have a model of the reproductive organs. I don't want to go into details of it. I'm sure it is familiar. Apart from this, we have what we call a speculum. I'm going to open it for you to see what it is. We do have a gel, which is used for lubrication. And we have what we call a pap smear kit, this one here. And we are going to show you how exactly it's used. We do have gloves, and I'm going to wear the gloves to show you exactly how we do it. So I'm wearing my glove here. These are clean gloves. We don't want to introduce any infection on the client. So you wear it like this. And of course, the client will be on the couch, of course, undressed appropriately and covered appropriately also, and having, of course, given the consent for the same, and having been explained exactly what we are going to do. And at that point, when she's comfortable and we have reassured her, we would start with this. For this one is the most dreaded, at least for the women whom I've talked to, most dreaded. And that is actually theoretical because they have heard about it. And previously it used to be metallic. Some areas they still use metallic. This is disposable and it's very, very comfortable. Women whom have had to go through this, they'll tell you it is comfortable, it is plastic, and it's more friendly, as it were. And then after that, we actually use the lubricant, and we would lubricate it like this, like that, generously, as need be arise, and apply the gel here, this particular part only. And this is the part as it is, which would usually go to the birth canal. The rest of this is really to assist in visualizing, and we usually visualize from this end to where the cervix is. So it's called a speculum. We've lubricated it very well. It's basically just to open up the birth canal for us to be able to visualize where the cervix is. And in position, we'd usually insert this through the birth canal up to where the cervix is. And at that level, then we open up. We'd usually open up the speculum so that we are able to see the cervix at that particular end, as you can see over there. And then we will fix this speculum. It's a way in which we would usually fix it so that it remains in position. If it is open like this, we'd usually fix it so that it opens and remains in that particular position. So once that has been done, then allow me to place this one here. As it is. Then we come into this, what we call the pap smear kit. This has several components. It has the brush, which is here, which I'm going to open for you to have a look. There are 3 types of brushes, but we're going to use one of them. Most of the time we use one. And you open it like this in a sterile, clean way. And for today, we are going to use one of them, which is the brush. You don't need that one which has fallen down. So this is the brush. And this brush, usually we use it to collect cells from the cervix. So assuming this is the cervix, which is here, so would usually go in, sorry, wants to fall off. We'll go in up to that position and we rotate 360 degrees on the cervix. So practically up to there, that's the cervix, and then we rotate 360 degrees there. The science behind it is it picks up loose cells. So we're not cutting anywhere. It's basically just collecting loose cells from there, transferring them from the cervix to this particular brush, and then transferring the cells from here to the glass slide. If you look very keenly, we have the glass slide here, and we generally like smear. We smear on that glass slide, and thus transferring those cells from the cervix to this glass slide. After that, there's some fluid which we call a fixative, which we put on the slide, and that is what goes to the lab. But before it goes there, this is what we do on this box. The cells from the cervix are now on this glass slide. We close it like this, like that. Of course, we would have written the patient name here, and we close it up like that. It's not closing very well, but there it is. Yeah, like that. So this is pap smear. Cells have already been collected. They're here. We've labeled the name, and we send it to the lab. In the laboratory, what they do is they prepare, and the pathologist is able to tell us what's the actual nature of these cells. Are they normal or not? And if they're abnormal, what's the extent of that abnormality? Is it something which we can maybe wait and watch? Is it something which must be investigated further? Is it something which has to be treated immediately? Or is it something which is pointing towards a possibility of cancer being there? So that is actually the process of doing pap smear. We try as much as to be gentle, and nothing to fear about. A little bit of discomfort, but it's worth it. It saves lives. This simple procedure saves lives. Of course, there are other methods of screening for cervical cancer. We have what we generally call 𝐒𝐫𝐨𝐫𝐚, which is basically just looking at the cervix, putting some fluid there, reagent, and telling if the cervix has any changes or not. And some of you, our viewers, you may have done HPV testing, that is human papilloma virus testing. That's another method of screening for cervical cancer. But today, we were looking at pap smear. That is the commonest, that has been in use for a long time. It is still used. It's extremely very important. Now, having said that, what are the symptoms of abnormalities which should keep you worried, or which should concern you? Not really worried, but concern you. If there is an abnormal vaginal discharge, as a woman, you know yourself, you know your cycle, you know when you have this or that secretion. If that changes, then that is important for you to see your doctor and seek medical advice. If there's an abnormal vaginal discharge, especially one which has some pus, which has a bit of pus, would mean there is some infection, but infection also may mean there's something underlying that. If there's any abnormal bleeding, either because of sexual contact, or any bleeding in between your cycles. You've had your period, you're waiting for the next period, but in between you're spotting or you're bleeding, what we call intermenstrual bleeding. That is not a good thing. Or if you've gone into menopause, I'm talking now to the older women among us. You've missed your periods, you've gone into menopause, and suddenly you see some blood spotting. That is always a bad sign. Find out what it is. It may not mean there is cancer, but it may mean that there is something which needs to be looked at, to have an explanation, because that is not expected, to have an explanation why that bleeding is actually happening. The others, like pain. Pain is not really one of those major early symptoms. Remember, we are talking about We're talking about cervical cancer screening. It is screening because at that particular point, there's really no symptom. So by the time there is symptoms, it's like a little bit late. So that is why we need to do pap smears early. So pain is not one of those major things in cervical cancer. So let's not wait for symptoms like pain to really go for medical checkup. There are other symptoms which could happen there. Maybe just bleeding after exertion, after doing some work, bending and carrying heavy stuff, and then this abnormal bleeding. So the take-home message really today was the importance of screening for cervical cancer. Remember, cancer, especially cervical cancer and breast cancer, these are the two leading cancers in this country. And unfortunately, they cause a lot of deaths in this country. But the good news is they're preventable. And it is on you as an individual to actually take the initiative. And we are here to assist. As I finish, this is Dr. Orora Maranga, gynecologist, cancer specialist. Remember to subscribe, also share, so that this message can reach many, many more women, and it may save a life. Thank you. See you next time.